Hello, everyone, and welcome to today's session on addressing concerns and building trust in AI adoption in general practice. As we explore AI's potential, it's vital to acknowledge and address the reservations GPs and patients may have. Trust is key to successful implementation, and in this lesson, we'll examine common concerns, strategies to overcome them, and ways to foster positive relationships between GPs, patients, and AI systems. Building on previous lessons, like Lesson 1.3 on regulatory and ethical considerations, we'll dive deeper into issues such as data misuse and bias, focusing on practical solutions. Let's start by exploring the most common concerns. AI has tremendous potential, but its adoption isn't without challenges. Many GPs and patients share common concerns about its use in healthcare, which we can broadly categorize into existential anxiety, data misuse, and diagnostic bias. These concerns stem from the unfamiliarity of relying on AI for critical decisions and the perceived complexity of these systems, which can make them seem opaque or untrustworthy. Also, fears about AI undermining professional autonomy and altering the traditional physician-patient dynamic contribute to resistance among healthcare providers. For patients, the idea of sharing sensitive data with AI systems or receiving recommendations influenced by potential biases can raise valid questions about privacy and fairness. Existential anxiety arises from the fear that AI might replace human roles in healthcare, particularly physicians. This concern is understandable given AI's ability to diagnose diseases, analyze large datasets, and predict outcomes. For instance, a 2024 study in the New York Post showed an AI tool detecting prostate cancer with 84% accuracy, surpassing doctors' 67%. AI also processes data rapidly, offering faster diagnoses. However, human involvement remains essential for optimal results. As discussed in earlier lessons, AI is a tool designed to enhance, not replace, human expertise. For example, AI systems in radiology can identify imaging abnormalities but rely on radiologists to interpret findings in the patient's broader health context. Similarly, in general practice, AI analyses patient records and suggests diagnostics, but decisions remain with the GP. Reassuring providers and patients that AI supports rather than replaces them is key to alleviating this concern. A major concern with AI in healthcare is the potential misuse of sensitive patient data. AI systems require large datasets, often including personal health information, raising fears of data breaches, unauthorized access, or unethical use. Transparency is vital to addressing these worries. Patients need to understand how their data is used, who has access, and the safeguards in place. Regulations like the EU's General Data Protection Regulation, GDPR, ensure data privacy, but GPs play a key role in communicating these protections. For example, you might explain how data is anonymized before training AI models or emphasize strict security measures to prevent unauthorized access. Building patient understanding fosters trust and alleviates concerns about data misuse. AI systems are only as effective as the data they are trained on. If training data lacks diversity, results may be biased or inaccurate for certain populations. For instance, an AI model trained on younger patients might not perform well for older adults, leading to disparities. Similarly, underrepresentation of specific ethnic or socioeconomic groups in training data could result in the AI failing to identify conditions prevalent or different in those populations. Bias may also appear in recommendations favoring treatments accessible to certain demographics, widening healthcare gaps. Mitigating this requires diverse datasets and ongoing monitoring. As GPs, you should question AI recommendations and apply clinical judgment to ensure equitable care. For example, if an AI recommends medication based on urban data, you might adjust it for a rural patient with different circumstances. Now that we've outlined the concerns, let's discuss how to build trust in AI systems among both GPs and patients. One can say that generally, trust is built through transparency, accountability, and collaboration. Addressing common concerns like data misuse, diagnostic bias, and existential anxiety, which we just discussed, provides the foundation for this trust-building process by acknowledging and actively mitigating the risks that create skepticism. For GPs, this means being transparent with patients about how AI tools are used, ensuring they remain in control of the decision-making process, and emphasizing that AI is a supportive tool rather than a replacement for clinical judgment. By fostering collaboration between technology developers, clinicians, and patients, GPs can help shape AI systems that are both practical and trustworthy, aligning with the realities of patient care. Let's look at transparency in terms of building trust. Transparency is essential for building trust in AI systems. It involves clearly explaining how AI works, its limitations, and the data it uses. Both GPs and patients should feel confident in understanding AI recommendations. For instance, if an AI system flags a potential diabetes diagnosis based on lab results and symptoms, transparency would mean the system explaining its reasoning. It might note that the patient's fasting glucose exceeded a specific threshold, their HbA1c was in the pre-diabetic range, and their symptoms, like increased thirst and frequent urination, matched patterns seen in diabetes cases. As a GP, you could review these factors and share them with the patient, saying, "The system flagged diabetes as a possibility because your fasting glucose level was 130 mg/dL, which is above the normal range, and your symptoms align with typical patterns. Let's confirm this with further tests and discuss your history in detail." This approach clarifies AI's role while reinforcing your position as the decision-maker, ensuring patients feel informed and confident in their care. Accountability is also essential for trust building, ensuring AI systems meet high standards and always include human oversight. GPs must retain ultimate responsibility for patient care, using AI to inform, not dictate, decisions. For example, if an AI system flags a patient as high risk for a condition, the GP must critically evaluate the output, using their expertise to validate the recommendation. This reinforces that AI complements, rather than replaces, human judgment. Collaboration is another key to integrating AI effectively into general practice. Partnerships between technology developers, healthcare providers, and patients ensure AI tools meet practical needs. For instance, involving GPs in the design of AI systems, such as providing feedback on usability, helps align the technology with clinical workflows. Engaging patients in discussions about AI's role in their care fosters trust and collaboration, ensuring that AI supports, rather than undermines, the physician-patient relationship. A common concern is that AI might depersonalize care or reduce time with patients. However, when used effectively, AI can enhance the physician-patient relationship by automating routine tasks like updating records or scheduling follow-ups. This reduces administrative burdens, allowing GPs to focus more on patient interactions. For example, instead of typing notes during appointments, you can maintain eye contact and engage fully with your patients, fostering meaningful conversations and building trust while improving the overall quality of care. In today's session, we addressed common AI concerns in general practice, including existential anxiety, data misuse, and diagnostic bias. We highlighted trust-building measures like transparency, accountability, and collaboration, while emphasizing the physician-patient relationship. Key takeaways include AI augments rather than replaces healthcare providers, transparency about data use and safeguards builds trust, diverse datasets and questioning AI outputs ensure equitable care, and fostering confidence requires accountability and collaboration. Finally, AI reduces administrative tasks, enabling GPs to spend more time with patients. As GPs, you are at the forefront of integrating AI into general practice. Your ability to address concerns, educate patients, and apply these tools responsibly will determine the success of AI adoption in healthcare. By fostering trust and emphasizing the supportive role of AI, you can ensure that these technologies enhance rather than hinder the quality of care. Thank you for your attention today.